Hello, I'm Janet DeMille, Medical Officer of Health of the Thunder Bay District Health Unit. I want to speak to you today about our current situation with COVID-19. While this issue is primarily in the Thunder Bay and surrounding communities, it is important that for those of you in the district to pay attention as well, because we are seeing the risk present throughout our whole area. There is no sense in sugarcoating it. Things are not looking very good right now. Cases are at an all-time high in the Thunder Bay District. A significant and uncomfortable amount of cases are being reported every day. We are in lockdown. The schools in Thunder Bay are closed for in-person learning. And we are facing the risk posed by the variants of COVID-19 that are rising across the province. I know we are also tired, anxious, and stressed. We are in the worst situation we have ever experienced here so far in this pandemic. Today, I'm going to give you some information about our current situation and what we are currently seeing. I'm also going to tell you what we can do about it, what we need to do about it. I am confident that no matter how challenging our current situation is, that we can get through this, that we will get through this, and we will do this together. I have previously told you that COVID-19 can be anywhere, that it will seemingly appear out of the blue, and it can and will spread quickly. That is exactly what we are seeing. COVID-19 is essentially everywhere. It is in many different places, and it is spreading. It is in workplaces, it is in daycare. We saw cases in schools. It is in retirement homes, healthcare settings. It is in the retail outlets where you go shopping, for example, your local grocery store. It is in people's homes and apartment buildings. Not so long ago, we advised you, the public, that an outbreak was happening in the vulnerable population in Thunder Bay. At that time, this outbreak was the major contributing factor to the increasing case numbers we were seeing at that time. That is no longer the case, though. Even at that time, several weeks ago, there were other cases that were occurring. Now those other cases, the spread outside of that vulnerable population, is what is driving our case numbers and leading to the ongoing increase in those numbers. Unfortunately, this is not really settling down. I want to share with you some of the things that we are also seeing that are contributing to our case numbers. We are seeing that people are interacting a lot with other people. This virus is having an easy time spreading from one person to the next and to the next. We in public health are following up with a lot of people at risk because they have been in close proximity or having interactions with somebody who had COVID. And in many situations, that person didn't even know that they had it. Those people at risk are then getting sick with COVID, and they themselves are passing it on to others. That is reflected when we report to you new cases as close contacts. It has spread in households, it has spread in workplaces. We saw spread in school settings. We see spread when people are getting together. Another thing that we are seeing is that people are going out, going to work, for example, or hanging out with others when they have symptoms. They are passing on the virus to others even before knowing that they themselves have COVID. In fact, they might be quite surprised when they find out that they actually have COVID. This is what this virus is like. This virus is tricky. It can present really mildly. It may seem like just a cold, but it is not. So what can we do about this? First of all, we all need to assume that wherever we go, wherever we are, COVID is there. When you go to a grocery store, when you go to the bank, when you're filling up your car with gas, when you pick up food, takeout food, for example, assume that COVID is there. When you go to work, assume that COVID is there. It is all those basic measures that we can take that can make the difference. These measures will reduce the likelihood of getting COVID-19 ourselves or of giving it to others when we might unknowingly have it. There are 5 main recommendations I want to make to you today. Limit your in-person interactions with others. Stick to your own household members. Stay at home as much as possible. This is not the time to have in-person social gatherings. This is not time to visit other people in their homes or to have somebody come over to your home. This is not time to be hanging out in person with friends or extended family. If you have kids, your kids should not be getting together with other kids for play dates or sleepovers or whatever they might want to do. All of these activities can spread COVID-19, and they are spreading COVID-19. The second recommendation is for all situations when you are outside your home. If you are going to your place of work, if you are going to the grocery store or picking up food at a restaurant, if you're a staff person who's working in a store, follow all the measures that are in place in those settings. Measures like wearing a mask, staying 2 meters from other people. Do not go into those places if you have any symptoms. When you are going to work, please be careful of your interactions and proximity with your colleagues or co-workers. If you are a worker who wears personal protective equipment, make sure that you wear it properly and that you wear it consistently. The third thing is screen yourself every day for symptoms. Check yourself for symptoms. Be very aware if you have any symptoms or not. Don't leave your home if you have any symptoms. Get tested, stay home and isolating at home until you get a negative test result back. Don't assume that what you have is just a cold. What may seem like a cold could very well be COVID-19. Don't go to work in person if you have any symptoms, even if they're mild. Note that if you have symptoms, your household members need to stay home too until you get that negative test result. If you yourself have COVID-19, or if you have been in close contact with somebody who with COVID-19, follow the directions of public health, such as isolating and getting tested if you're directed to do so. This will prevent you from passing on the virus to others if you actually have it. My 5th recommendation is for businesses, workplaces, and any other organizations. Review all the measures that you have in place. Consider what you can do to enhance or strengthen those measures. Remind your customers or your staff of the importance of abiding by all of those measures. Make sure your employees or staff are screening themselves for symptoms, even when they're at work, and not coming to work or leaving work if they have any symptoms. Support them in doing that. If you're an organization where PPE is used, again, the mask and eye protection, make sure your employees or staff are using them properly and are using them consistently. I know these are tough times. I know that many of you are feeling anxious and stressed. I know that many of you are quite frustrated. We are all tired of this pandemic and the sacrifices that we have had to make throughout this past year. We don't want to do this anymore, but we need to. We need to do this for longer. We need to continue all of those efforts to bring our case numbers down, to prevent the variants of COVID-19 from getting a hold in our area. And we need this to be able to resume our regular activities and have the businesses here reopen and the schools reopen. I am confident that no matter how challenging our current situation is, that we will get through this, that we can get through this, especially if we do this together. I encourage you all to take this very seriously. We can do this. Stay safe, stay strong. We can do this.